without having a CPAP machine on your nightstand, I think is a is a plus. So that's one way it would definitely help the bed partner. Plus, a lot of these patients are brought in by or sent in because of their snoring, because of their bed partners complaining. So once they use the device, it will help the bed partner. Or if they don't use the device and the bed partner sees a change, they can definitely help them motivate the patient to using the device. Patient selection is again the FDA label for what eXciteOSA has been approved for now. It's primary snoring and mild obstructive sleep apnea, and so those are the patients who I would prescribe this to, and also patients who've failed or are not compliant with their auto CPAP or CPAP therapy with mild sleep apnea.